Hello, everyone, and welcome to our workshop today with Victoria Jarvis from Vermont Health Connect. I'm Jamie Rainville, co-director of Family Support at Vermont Family Network, and your host for today. Thank you for joining us for the third of 8 workshops in our Persevering in the Pandemic online learning series. If you missed our earlier events, the Vermont Health Center for Disability Rights Back to School Town Hall on September 18th, or Wordless Humor and the Element of Surprise to Increase Connection with Older Kids and Tweens on September 21st, you can find the recording links on our website. We would like to take a moment to recognize and thank our generous sponsors for making this learning series possible. Vermont Family Network has been serving families of children with special health needs and disabilities and the professionals who serve them for more than 30 years. We are the federally designated Parent Training and Information Center and the Family to Family Health Information Center, the Vermont chapter of both Family Voices and Parent to Parent USA. Today's workshop is being recorded and will be saved on Vermont Family Network's website and YouTube channel. Everyone who registered for today's workshop will receive a follow-up email with a link to this recording and an evaluation. Since this is a webinar, you won't see the other participants and everyone is muted. To ask a question, you can type it into chat or use the raise hand feature to be unmuted and ask your question out loud. There will be time during and after the presentation for question and answers. I'm excited to introduce to you Victoria Jarvis, who is the manager of the In-Person Assisters Program at Vermont Health Connect. Thank you so much for joining us today, Victoria.
Thank you so much for having me, Jamie. My name is Victoria Jarvis, and I am a program manager with the Department of Vermont Health Access here in Vermont. I'm excited to be here today to present to you the Coverage to Care, which is about insuring Vermont families here in Vermont. So I am Victoria Jarvis. Again, just wanted to say my name. My pronouns are she, her, and hers. And as we begin this presentation, I'm going to turn off my video to kind of save my internet bandwidth. I want to let you know that I'm very comfortable using technology. I want to make sure you're comfortable too. So please feel free to ask questions in the chat, but I'll also have points in the presentation in which I can stop and accept questions as needed. So let me know if I'm moving too fast or if you'd like me to slow down, highlight anything. I'm happy to do that. So as I was saying, I'm an employee with the Department of Vermont Health Access. I've worked for the Agency of Human Services, which is one of the departments, which is the agency that houses the Department of Vermont Health Access since 2014 with the establishment of Vermont Health Connect. And inside my department, we have Vermont Health Connect, which is for coverage under the age of 65 and not determined disabled. So this coverage type is for Vermonters, again, under the age of 65 and who have not been determined disabled by the Social Security Administration. Then we also have Green Mountain Care, and this coverage is for people who are over the age of 65 and or blind or determined disabled. Within Vermont Health Connect, we have Medicaid for children and adults. We also offer qualified health plans with or without financial help. And under Green Mountain Care, we offer Medicaid for the age blind and disabled and Medicare Savings Program and prescription assistance programs. The first coverage type I want to talk about is Medicaid for children and adults. In Vermont, our coverage for children and pregnant persons is known as Dr. Dinosaur. Before the establishment of the Department of Vermont Health Access after the ACA was passed, you may recall that Medicaid for adults was known as VHAP. Vermont as a state has already expanded Medicaid through VHAP when the ACA was passed. This means that Vermonters who are at or below 138% of the federal poverty level may qualify for Medicaid for adults. This is the type of Medicaid that is based on income. So when we talk about Medicaid for children and adults, we want to talk about the low or free cost health coverage offered by this coverage type. It's important to know that there are other eligibility factors that may affect a determination for Medicaid, such as family size, household income, even citizenship and state residency. We need to verify these eligibility factors so that we can make a correct determination. That's why after an application, it's important to keep an eye out for letters from us asking you to submit further verification. This is usually about income because it's harder to verify. We try to use the income from the Department of Labor or IRS or other sources that may verify this income for us as much as we can without asking you for further documentation. You can apply online for Medicaid for children and adults, or you can apply by phone by calling 855-899-9600. You can also complete a paper application and mail it in. Medicaid enrollment is year-round. That means you don't need an open enrollment period to enroll. If you think you might be eligible, you can apply and find out at any time. Currently, there are special rules in place due to the COVID-19 public health emergency, and I'm going to cover those a little bit later. Let's just talk about quote-unquote normal eligibility for Medicaid for adults. You might be eligible for Medicaid for adults if you're under the age of 65 and not entitled to or enrolled in Medicare Part A or enrolled in Medicare Part B. Most income eligibility limits for Medicaid and Dr. Dinosaur are based on percentages of the federal poverty level. The ACA established a minimum Medicaid eligibility of 133% of the federal poverty level for children, pregnant women, and adults. This occurred in 2014 and included a standard income disregard of 5 percentage points. So when we talk about Medicaid eligibility, we actually talk about a 5% income disregard. This expansion of Medicaid itself made many parents and other adults newly eligible for Medicaid in 2014. Before the ACA, most states limited eligibility level for parents to less than the poverty level, and other adults were generally not eligible regardless of income. But when the Medicaid expansion was enacted and implemented nationwide, we allowed for 100 to 138% of the federal poverty level to enroll in Medicaid. So that greatly expanded the number of people that qualify and become eligible for Medicaid. And then we also have Dr. Dinosaur, which is the coverage for children who are under the age of 19 or pregnant persons. Children under the age of 19 with household income at or below 312% of the federal poverty level, plus that 5% income disregard, may be eligible for Dr. Dinosaur. And then pregnant persons with an income at or below 208% of the federal poverty level, plus that 5% disregard, may also be eligible. Don't worry, I'm going to show you some charts that expand this a little bit better. And of course, Dr. Dinosaur is a free program for pregnant persons with qualifying household income. Depending on that income and the family size, Dr. Dinosaur for children may have a monthly premium of up to $60 per household. But now during the public health emergency, we have suspended those premiums, and I'll talk about that again a little bit later. So I wanted to show you what the income levels for Medicaid for children and adults in 2021 looks like. Those 2021 income eligibility rules went into effect in April of 2020, and they'll stay into effect until April of 2021. So here's what those income levels look like. By household size, you can see the different income levels that may qualify someone for Medicaid for adults, for pregnant persons, or for children under the age of 19. One thing to keep in mind as you look over this chart, when any member of the household is eligible for Medicaid in any form, pregnant persons, Dr. Dinosaur, they can reject other offers of coverage, or they can keep that other offer of coverage. Medicaid is a payer of last resort, which means that if someone has Medicaid and another type of insurance, like employer-sponsored insurance, they can stay in their employer's plan, and Medicaid pays the charges that their primary insurance doesn't cover. Or they can choose to reject that plan offered by their employer and have Medicaid as their primary and only coverage. Some employers tell their employees that they cannot enroll in Medicaid if they have coverage offered by their job, but this isn't true. If someone is eligible for Medicaid, or if someone in their household is eligible, they can choose to enroll in Medicaid at any time. For example, if a family has 2 adults, one working with a job that offers the whole household health insurance, the household can choose to cover the children in Dr. D if they're eligible. They can choose to enroll in Medicaid instead of the employer's coverage if the whole household is eligible. Or if one adult becomes pregnant, they can choose to enroll in Pregnant Dr. Dinosaur if eligible. In other words, it's all about eligibility for these programs, not other kinds of coverage offered. Now, once a household goes over the Medicaid eligibility income thresholds that you're seeing right here, their options change, and I'll cover those in just a moment. So questions about Medicaid for children and adults, the income-based Medicaid.
Victoria, we have some questions in the chat. I am not able to see them actually.
Okay, let me just
Are you able to bring them up?
Let me check. Yes, okay. How is the family size determined if a child lives between 2 households because of a divorce? That is a great question. There's a couple of other questions in that paragraph, so I'm gonna just stay with that one question for a second and answer that. So in Vermont, we do have a lot of those kind of households where a child may move in between parents. They may have one parent who takes care of them partially. The child may go between the 2 households. For us, when we're trying to determine the coverage for the child, we're going to take into account both the parent's income and any of the child's siblings living in the household. So if a parent has one child from a relationship, and then they have another child from another relationship, and those 2 children are half siblings, we'll keep them in the same household, which enlarges the household count and allows us to use more of a wider income threshold. So the most important thing to do when working with 2 different households like that is to just list the parents on the application and we'll figure it out. The other question is, let's see, can Medicaid be retroactive? Fantastic question. It can be retroactive once determined eligible for 90 days after the eligibility is determined. So for example, if I apply today, which is October 1st, and I become eligible for Medicaid, my Medicaid starts on October 1st because that's the first day of the month. But I can also apply for coverage for claims that I might have from September or August or July, because it's 90 days back from the first date that I was enrolled into Medicaid. My son went to the ER with no insurance and then got Medicaid. So a lot of times when people apply, they're applying because they've had a sudden claim, right? They've had an accident or they've had something happen that causes them to see if they're Medicaid eligible. It's really important to understand, again, that you can apply for Medicaid at any time. So if you've had any sort of reduction in income, or you've lost hours that have caused you to lose any kind of coverage, or you just don't think you're adequately insured, you should think about applying, because we can determine if you're eligible for Medicaid and start that coverage at any time. But you don't want to wait until something happens and then try to apply retroactively. What is the ACA? That's a great question. It stands for the Affordable Care Act, which was passed in 2010 and then established Vermont Health Connect as a state-based exchange in 2014. It's important to know that Vermont had already taken steps to take the changes to our healthcare coverage before the ACA was even passed. We had VHAP, which is the Vermont Health Access Plan, and that was expanded Medicaid, like you're seeing here now. So the ACA went into effect at the federal level after Vermont had already taken steps as a state to kind of make those changes ourselves. Is monthly gross income, sorry, I wasn't reading that right. Is monthly income gross income before taxes and deductions? Another fantastic question. When we're talking about Medicaid for children and adults, we're talking about modified adjusted gross income, which is not a line on your tax return. So it can get really confusing. But basically, it's your adjusted gross income, your AGI, which is a specific line on your tax return. And then we have several tax deductions taken after that. Things like, actually, I hesitate to speak about specific deductions. We do have a list on our website, and we can talk about that privately if you'd like. But the point is that we have several different deductions that are not listed specifically on your tax return. So we want to modify that adjusted gross income to try to bring down the income threshold just a little lower for eligibility. If a person is self-employed and monthly income varies, how do you calculate if someone is eligible? Another great question. In the month that you apply, we're only looking at 30 days backward. So for example, if you lose your job today, the first of the month, and you apply today, we're going to count your income moving forward as 0. Even if you've applied for another job and you think you might get it and you may have income moving forward in the month of October, what you have right now at this exact moment in time is 0 income. So that's what we use to calculate when we're determining your eligibility. It's most important to apply as soon as you've had any reduction in income, any reduction in hours. We want to determine you eligible as soon as possible to get you back into adequate coverage. Now, when we're talking about qualified health plans, it can be a different scenario. So I'll make sure I cover that when we go into qualified health plans next. But I do want you to know that as soon as you've had any reduction in income and you think you might be Medicaid eligible, please apply so that we can make a determination. What about a 21-year-old living at home and working, paying their own taxes? Can that 21-year-old apply as a single person? What if they're paying rent? Another fantastic question. I am loving these. So after the ACA was passed, one of the things that the components of the Affordable Care Act was to make children under the age of 27 allowed to stay on their parents' coverage. That means that if you have, say, for example, employer-sponsored coverage and you have a child who is 21, they can stay on your plan, and we don't calculate or factor in anything other than their income as it applies for their eligibility. So, for example, you can keep them covered as a dependent on your employer-sponsored plan until they turn 27, and then they need to go get their own coverage policy. Now, when we're talking about things like Medicaid, we still factor in them as a member of the household, and we do calculate their income. But children for Medicaid for children and adults doesn't have a resource attached to it. So we don't take into account things like rent or cars or properties owned when we're talking about this type of Medicaid. Now, once someone turns 27, they'll need to come off of your plan and enroll into their own coverage policy. And when we're talking about children who might have been in foster care, we will keep them on their Medicaid coverage if enrolled when they turn 19 to the age of 27, because they don't have that same benefit as their parent, as being offered coverage to stay on their parents' plan. So Medicaid steps in to keep them covered during that 19 to 27 year span. Will we be going over Katie Beckett renewal paperwork, especially the 3-year eligibility paperwork? Great question. I have a specific eligibility expertise, and it ends at Katie Beckett. We have another presenter whom I am great personal friends with. She's a fantastic colleague, and she'll be talking more about Katie Beckett. I'll just lightly be covering some of the COVID-19 rules that are in place. So unfortunately, I can't speak to the Katie Beckett renewal paperwork. I can only speak to Medicaid for children and adults and Medicaid for age blind and disabled paperwork. But I'd be happy to send Betty Morse, who's going to be your presenter, that question if you'd like.
And Betty will be presenting for us on October 29th from 12 to 1. So you can check into our website. Feel free to reach out to any one of us and we can send you that information as well.
Great. Okay, so are there any other final questions before I continue on to qualified health plans? Okay, I'm going to stop my video one more time. Okay, so let's talk about qualified health plans. These are also offered through Vermont Health Connect. When we talk about Vermont Health Connect and Vermont as a state, it's important to know that Vermont is community rated, meaning that insurers cannot charge someone a higher premium based on health status, claims experience, gender, occupation, smoking status, etc. This is true for any health plan offered or sold in Vermont, including employer-sponsored coverage and privately purchased coverage. Now, qualified health plans, like many employer-sponsored plans, work similarly with the monthly premium. With qualified health plans, the premium is paid monthly online, over the phone, or by mail. This coverage is dependent on a paid premium paid in that month, much like utilities. But unlike utilities, if the premium is not paid for 6 months, the coverage can be canceled and then backdated to that first month the premium wasn't paid. So if a customer terminates a qualified health plan and still owes back premiums, for example, they may have to repay those premiums before they can re-enroll in another qualified health plan. So when we talk about qualified health plans, it's important to know that all include essential health benefits. I've put a link into what those benefits are. They cover things like primary care, ambulatory care, pharmacy, and things like that. There are 10 essential health benefits to every plan sold and offered in Vermont. And we also have premium rates that are tiered based on who is covered by the plan. Single, couple, parent and children, or a family, up to 2 adults and children with no cap. Now I wanted to also cover, whoa, I think I just lost my screen there for a second. No problem, I'll get you right back. Sorry about that, y'all. I got way overexcited about qualified health plans for a second. So qualified health plans are for Vermonters who are not offered otherwise affordable coverage. Now I know that term, affordable, it's a subjective term, right? I think my car payment is unaffordable. But qualified health plans also work along the federal poverty levels that we were talking about with Medicaid. And that way we can take the subjectivity out of the affordability discussion. Now, the plans were created with an idea of metal levels, platinum being the highest and bronze being the lowest. These plan levels were designed to put plans in an easier format to understand, but I do recognize this is still pretty confusing. Some employers also offer metal levels in their plans, so I wanted to explain this concept a little more robustly. So, if you consider that the entire cost of your healthcare coverage, the premiums, the costs you pay at the provider and the pharmacy, are put into a pool that equals 100%, this chart is showing you what type of percentage you're going to pay and what the insurance carrier pays. At the bronze level, you'll pay less for a premium, but more at the doctor's. At a platinum level, you'll pay more for a premium, but less at the doctor's. So how does this work out for you? Consider that someone in their late 20s with no healthcare concerns, really. They visit the doctor once a year for an annual exam. They know they need to be covered for a catastrophic event like an accident, but they don't want to put too much a month toward that coverage. So a bronze plan might work better for them. But look at me, I'm 50 years old. I have several health concerns like asthma, I need a couple of specialist appointments a year, and I take several expensive medications for it. I know my health needs are high, and I may have an ER visit in my future as we enter the winter months, so I know I need a robust plan. But I definitely do not want to bother with paying out of the pocket every single time I visit the doctor. I don't want to have to worry about each visit and what it's going to cost me, what I might pay at the pharmacy. I can choose a platinum plan, and I know my out-of-pocket costs are going to be lower at the provider. I may have a lower maximum out-of-pocket as well, and I can plan safely for any surgeries without financial concerns that might have come with the bronze plan. But I do need to recognize that I'm going to have a higher premium every month because of that. Now, how can we help bring down those costs? I'm going to show you a pretty expansive chart. It's awful. I apologize. But it does show you the income levels for those extra savings at the provider I was just mentioning. One thing that jumps out at me here is the range of income levels that can be eligible for extra help. When we talk about extra help, we're talking about APTC, Advanced Premium Tax Credits. This is what brings down the cost of the premium. But remember, this is literally an advance on tax credits. So if you don't file your taxes, or if you make more income and receive more subsidies, you may be liable for a repayment penalty. I'll explain that in just a moment. VPA stands for Vermont Premium Assistance. It's just a little more that Vermont as a state wants to contribute to help bring down the cost of the premiums. And CSR stands for Cost Sharing Reductions. So as you can see, a family of 4 will qualify for Medicaid for children and adults as an entire household at $26,200 annually earned by the entire household a year. But they can earn up to $104,800 annually and still qualify for advanced premium tax credits. It's important to know as well that married couples must file jointly. They can't file separately and receive subsidies because it makes it too hard for the IRS to kind of calculate how those subsidies would have mapped out between 2 separate households, which is what occurs when someone files separately as a married couple. So let's talk specifically about cost sharing reductions. One thing that Vermonters struggle with is the cost when seeking care at the provider or getting medications at the pharmacy. They are paying a premium, but they still have to pay too much out of pocket when they go to the doctor, and that can cause people to avoid care, which is the last thing we want. So Vermont offers cost-sharing reductions designed to bring down the cost when using your healthcare coverage. It's a discount that lowers the amount you have to pay out of pocket for deductibles, co-insurance, and co-payments. These are costs that are outside of the premium. They're costs that happen when you go to the doctor and when you pick up prescriptions. Cost-sharing reductions are an added savings for households between 138 to 300% of the federal poverty level. These are added benefits for Vermonters who are just above the Medicaid eligibility threshold. And that's kind of confusing language, so I wanted to show you a chart in a few slides that explains this a lot better. So what we're looking at here is a family of 4 and what they might qualify based on their income. As you can see, they can earn up to $36,158 a year as a household and still be eligible for Medicaid and for children and adults. But once they cross over, sorry, I got overexcited again. There we go. So once they cross over that income eligibility threshold, they're going to enter the cost sharing reductions thresholds that you see right up to, they can make $78,600 a year and still get those extra cost savings when they visit the provider or pick up medications. And then they can earn up to $104,800 a year and still qualify for advanced premium tax credits. So it's a very large range of plans that Vermont Health Connect can offer someone. But it's really important to know that when we're talking about qualified health plans, they're designed for people who are not eligible for otherwise affordable coverage. So if someone has an employer who offers them a coverage plan, we have to determine whether or not that coverage plan is affordable for that household before we can offer them coverage from Vermont Health Connect as a qualified health plan. And this is again because qualified health plans are designed to meet the needs of people who aren't offered otherwise affordable coverage. Now we're coming up into open enrollment 2021. It begins November 1st, and it's the time when any Vermonter can sign up for healthcare coverage, make changes to an existing plan, or see if they're determined eligible for any other kind of coverage types. We're very excited about this period. We want you to check us out to see if you're eligible. Again, if you have other kinds of affordable coverage offerings, we can help you determine whether or not you're eligible for a qualified health plan. It's important to know that if you miss open enrollment, you'll need a qualifying life event to enroll outside of it. So outside of open enrollment, between November 1st and December 15th, you'll need a qualifying life event. Things like divorce, loss of job, reduction in hours, loss of income, those kind of things trigger a special enrollment period, which allows you to enroll with us outside of open enrollment. Okay, questions about qualified health plans? Let me pull up the chat here.
Victoria, I am able to see the chat now. I'm happy to read you what has come in.
Fantastic.
So it says, my husband has coverage through his employer that is free for him, but is expensive for me, his wife, and our children. What are my options?
That is an excellent question. It's a battle that many Vermont families are having to contend with. When an employer offers their employee coverage, we have to determine whether the employee, their plan is affordable. So even though it's very cheap and affordable for that exact employee, it's not affordable for you. But unfortunately, we have to stay with that employee. So if that employer offers you the ability to enroll into his plan, even though it's very expensive, we're not going to be able to offer you a qualified health plan to enroll in unless you have a qualifying life event and or the employer offers coverage that becomes unaffordable. So basically what I want to encourage you to do is to fill out an application and see if we can determine whether or not that coverage is affordable for your household. It's a percentage. It's like 9.78% of the household's income compared to what the covered employee pays. It's very complex. Again, I just want you to reach out to our customer support center when we're talking about coverage for the 2 adults in that household. But when we're talking about children under the age of 19, they can enroll in Dr. Dinosaur at any time, and the eligibility is based on the criteria such as income. It's not based on what the employer is offering you as a family to get those kids covered. In fact, you can choose to enroll into the employer's coverage plan, and you can also have Dr. Dinosaur. And some people choose to do that because it's important to understand that Vermont Medicaid covers Vermont Medicaid providers. So if you seek care outside of the state of Vermont, you may not be covered by Medicaid in Vermont. We have a lot of providers who live along the state borders. So a lot of hospitals like Dartmouth or Boston, they are Vermont Medicaid providers. But it's important to know once you exit the state of Vermont, once you've gone past the borders, you really need to double check to see if a Medicaid provider is enrolled in Vermont Medicaid. So for example, if some kids travel outside of the state, they might keep them on their employer-sponsored insurance, but also have them on Dr. D just to get that extra help. Does that make sense?
Thank you. We do have one more question. I have trouble talking about all of this over the phone with someone that can help. Are there places that I can go to get in-person help with all of my insurance needs or questions?
That is a great question. I'm so glad you asked it. That's actually my quote unquote real job role. I manage a program that trains and certifies people who are outside of the state of Vermont employee group to talk to people about their coverage. So example, when you go to UVM Health at the hospital, they have 27 people who are trained and certified to assist you to get enrolled on site, right there at Patient Financial Assistance. Or if you're in, say, Brattleboro, you can go to Southeastern Vermont Community Action, SEVCA. You can go in Springfield to Community Connections. Up in St. Johnsbury, you can go to Community Connections in Northeastern Vermont Regional Hospital there on Community Drive. So I really want to say that there are over 175 trained and certified people in community-based organizations and providers' offices whose job is to get you enrolled. Providers, when you seek care, they don't want you to come into the office and be uninsured. They want you to be insured so that they can help get a treatment plan that covers you and get that coverage rolling for you so that you're not incurring costs, right? So when you go to your provider, ask if they have someone who can assist you getting enrolled. They will absolutely assist you. Every single Vermont hospital has a trained and certified person on staff. Most large provider groups do, and many community-based organizations are trained to assist their specific client base. For example, Brain Injury Association of Vermont has a specific person trained just for people who are their clients. We have Pride Center certified assisters. We have people who specialize in working directly with you and understanding your personal needs and coverage types. So I just really want to encourage you to give us a call. We can identify and connect you with someone directly.
Another one in the chat, I've heard that SEVCA no longer has a healthcare navigator, at least at the Brattleboro location.
I'm so glad you asked that too. I know I keep saying that, but these are thrilling questions to me. I'm very excited about healthcare coverage. So that's true. We had a great certified assister there. Her name was Elisha, and I absolutely adored her. She got hired by the state of Vermont, so she left her position at SEVCA. But since then, we have trained and certified 2 new fantastic people. So they do now have 2 trained certified assisters on staff to help people out in that area.
Great. So it looks like those are all of the questions.
Fantastic. Okay, so I want to jump into something that a lot of us don't think about when we talk about healthcare coverage, and that's dental, right? But before I do, I want to show you something a little complex. I'm going to be switching screens for a second. I wanted to show you a tool that we have on our website that can tell you all the coverage types that you might be eligible for under Vermont Health Connect. So I wanted to show you an example of a family here. We've got Maria and John. They're married and have 2 kids, Sam and Sarah. Maria is 30, John is 34, and together they earn $76,000 a year. So you're going to see the screen flash for just a second. I'm going to stop sharing so that I can share a different screen. Thanks for the time to note. I'm moving a little bit faster here, but okay. So here, this is our website here on Vermont Health Connect. It's the main page. It shows up when you land here at info.healthconnect@vermont.gov. We have a lot of decision tools. So if you click over here to the left and then click right here in the middle of the screen, we have this great plan comparison tool. So I don't want to watch a tour of how to use it. Now, so I've already loaded up Maria and John here. We've got Maria, we've got John, we have their 2 children, Sam and Sarah. They do not have other types of coverage offered, but we do want to know if they can get help paying for coverage. So I'll click yes. There are 4 people in the household. Neither Maria nor John is offered coverage. So I'm going to click no here. And we expect their income to be $76,000 a year. And then I'll click here to see my estimated help paying for coverage. And we can see here that Maria and John are eligible for a qualified health plan, and they can receive $808 in APTC, advanced premium tax credits. And they even land in a cost sharing reduction pool, the Silver 73 pool, so they'll get a little extra help paying at the doctor or provider. And Sam and Sarah are also eligible for Dr. Dinosaur. So this coverage tool, I'll scroll slowly back up, can tell you exactly what you're eligible for. And then once you see what your subsidies might be, and you've got that information, you can continue to see and choose plans. This can be a little confusing, but what it's showing you is the plan's cost for you in the year. And that looks like a lot, but what's important to look at right here is the monthly premium. So in other words, it'll show you the possible monthly premium after the subsidies are applied and what you might pay out of the doctor, at the doctor or the pharmacy. And then you can also filter the plans to see what types of plans might be better for you. So when we apply a filter like the Silver plan, because we have cost sharing reductions, we can see that there's a lot of other plan types that are available for us. So I wanted to show you that tool, which will allow you to see what kind of coverage you're eligible for, but it'll also allow you to pick different plans that might be available to you and allows you to apply those subsidies and see what your premium cost might be. So it's a really good opportunity for you to kind of pre-shop those plans. Again, open enrollment starts November 1st, so we want to encourage you to use our plan comparison tool. And I'm just going to show you again, this is what the result of the plan comparison tool was for Maria and John. And I've included a link to that plan comparison tool here in the presentation. So you can link right over to it to see it's completely anonymous. And you can also filter it by medical needs or other things and add people into the household if you'd like. So we love that tool. It's very helpful and it's also very exact. It's usually down to the dollar of what your possible premium subsidies might be. So again, I wanted to talk about dental plans and programs. Oh, I did it again, you guys. Tell you what, I just get so excited. And I'm going to start moving a little bit faster because I want to make sure to talk about coverages offered by Green Mountain Care. Sorry, you're hearing me click a lot there, but okay. So I'm going to very carefully touch this. Okay, so dental insurance in the ACA. Dental coverage is optional for adults, and for children, it's an essential health benefit. So basically what that means is that dental coverage is optional, but for children who are under the age of 19, they must be offered that coverage. So it can be purchased as a standalone plan through Vermont Health Connect, or when we're talking about plans that you can purchase through Vermont Health Connect, you can also purchase specific dental plans with the pediatric high option, for example. And we also have adult enrollee plans with Delta Dental, Northeast Delta Dental. And you can see those plans on our website. Now there's a very important program offered through Medicaid and Dr. Dinosaur, EPSDT. It's a Medicaid benefit for children and youth under the age of 21. It's meant to identify issues early and address them through the Medicaid program. And so it's really important to understand that that benefit is present and that we are continually adjusting that benefit for specific treatment needs. So if you have a specific treatment need that you feel like might be covered under this program, don't hesitate to reach out to us. We will absolutely test to see if it's possible. Okay, so let's talk Green Mountain Care. That's the secondary coverage type offered under the Department of Vermont Health Access. And it's a coverage type that we're much more familiar with, right? When we talk about Green Mountain Care, we offer Medicaid for the age, blind, and disabled. And we also offer prescription assistance, which helps eligible Vermonters pay for prescription medicines. Let's talk about the first most important coverage type, which is Medicaid for the age, blind, and disabled. To be eligible for this type of Medicaid, you must be a Vermont resident and meet one of the following criteria: being aged over the age of 65, blind or disabled as defined by the Social Security Administration, and also meet the financial criteria, which is including income guidelines and resource limits. And I've linked those resource and income limits in the presentation. It's important to know that there are other non-financial criteria such as Social Security numbers. You must possess a Social Security number. You must have a citizenship or immigration status. You must have residency. We need to know your living arrangements and the assignments of rights and cooperation requirements. We also need to pursue potential unearned income. Now, when we talk about resources, again, this coverage type does factor in resources. And I've put the resource maximums for you here and defined them as cash or other property, real or personal, that an individual owns or has the right or authority or power to convert to cash or is available for their support and maintenance. That's counted as a resource. And the limits vary depending on the type of the category and the services and the size of the Medicaid group. In other words, the household with the non-financial criteria applied. Now, let's say that if the excess resource amount remains after we've tried to exclude everything, the individual has not passed the resource test. We can still test for eligibility by quote unquote spending down or giving away those excess resources. Now, when we talk about spend downs, they're also known as Medicaid excess income, resources, surplus income, applied income. There's a lot of names that we've used over the years, but generally when you hear about us for Green Mountain Care talk about it, we're talking about and using the phrase spend downs. It's a process by which a Medicaid group incurs allowable expenses and we can deduct them from the Medicaid group's income and spending resources. Now, if you can see from this paragraph above, there's a lot of if applicables. The important thing to know about spend downs and coverage like this in general is that each case is unique. Each eligibility determination is going to be unique to that household. So if the income is if the outcome is one that you don't agree with, you can always appeal. You can appeal with us through our appeals team. You can go to Vermont Legal Aid and file an appeal with the healthcare advocate. You have a lot of options open to you. But in general, it's important to just remember when other people and family members and other households in your social circle or community talk about this kind of coverage and spending down, each case is going to apply differently. Now let's talk Medicare savings programs. It's a program to help low-income individuals with some of the out-of-pocket costs for Medicare, including Medicare Part A and B premiums, deductibles, copayments, and insurance. Eligibility for such MSP automatically qualifies you for extra help program as well, which helps beneficiaries with the cost of prescription drugs. And to qualify, you must be eligible for Medicare Part A and have income below a certain threshold. Now, prescription assistance programs, we know more familiarly as VFARM. And it's for people who are age 65 and older, or for people of all ages who have a disability. But you must have Medicare Part D, which is the prescription drug plan, and there is an income limit. There's also no retroactive coverage for VFARM, and there is no resource test. And then again, we have the Healthy Vermonters program. It's a discount program for Vermonters without prescription insurance who have met their manual or who have met the annual maximum coverage limit for prescriptions on their other plan. This is a really great program because it allows someone to pay for their prescription medication at the Medicaid payment rate, which is a significantly lower, in a lot of cases, payment rate than private insurance. There's no resource test and no premium obligation. And it does not offer retroactive coverage. So I wanted to cover very quickly Medicare. We want to talk about the parts of Medicare because it's important to understand how they interplay with both Vermont Health Connect and Green Mountain Care. So we're probably familiar with this, right? We have Part A, which is the hospital insurance. It covers inpatient care in hospitals, skilled nursing facilities, hospice, and home health care. And I put a link directly at the bottom of these, so you can go directly to the section on this in the Medicare Member Handbook. Part B, medical insurance, covers provider care, services from doctors, outpatient, home health care, durable medical equipment, and many preventive services. Then we have Part D, the drug coverage. Helps cover the cost of prescription drugs, and it's plans that offer Medicare drug coverage, and they're run by private insurance companies, but they follow the rules set by Medicare. Now, Medicare open enrollment is coming up. It begins October 15th and ends December 7th. And during this open enrollment period, just like Vermont Health Connect's open enrollment period, you can make changes to existing plans or you can enroll for the first time. I'm sorry, I made a mistake just then. I said you can enroll for the first time into Medicare during the Medicare open enrollment, and that's not true. In order to enroll in Medicare for the first time, you have an initial enrollment period that's around your 65th birthday. Now, if you didn't enroll during that time, you can enroll in an initial enrollment period, but that doesn't begin till January. So during the Medicare open enrollment, October 15th through December 7th, you need to already have established an initial enrollment with Medicare. Okay, I'm going to zoom through these very quickly. This is about Vermont Health Connect and becoming eligible for Medicare. Once you become eligible for Medicare, you cannot keep your qualified health plan but only under very specific certain instances. Once an enrollee's Part A starts, they can't get those advanced premium tax credits, those cost-sharing reductions that help to lower the cost for the qualified health plan. But they may be liable for a late penalty if they decide to sign up for Medicare at a later date. So it's really, really important to know that you need to contact Medicare within a month before your 65th birthday or a month after. Now, you can choose Vermont Health Connect instead of Medicare, but basically, bottom line is only if you're going to pay a premium for Part A. This happens when you didn't work enough work quarter hours throughout your lifetime, and you're liable for a premium for Part A, which is the hospital coverage. The enrollee can drop Part A and Part B coverage and get a qualified health plan instead. Now, if you only have Part B and also would have to pay a premium for Part A, you can drop the Part B coverage and get a qualified health plan instead. You have been determined disabled by the Social Security Administration. Remember that there's a 2-year waiting period before you can become eligible for Medicare. And when you're in that 2-year waiting period, you can choose to stay with Vermont Health Connect and enroll into a qualified health plan. Or you may be eligible for Medicaid for children and adults during that time as well. Wanted to put some links in here so that you can get Medicare specific assistance if you have any questions during open enrollment. Here in Vermont, we have a great program called SHIP through the Agency on Aging. I've also linked their website here. And just really quickly, I know we're short on time, so very importantly, I want to cover what the department is doing in response to COVID-19. We are temporarily waiving financial verifications required for those seeking to enroll in health insurance. What that means is you can self-attest to your financial income during this time. So when you apply, if you receive a letter from us asking you to verify your income, you only need to give us a call and give us a self-attestation that the income that you put on the application is the income you're actually earning. This is very important because it significantly speeds up the application, response, and eligibility determination. We have also been extending Medicaid coverage periods, meaning that the department is not processing the annual reviews that could result in the loss of Medicaid until after the emergency ends. This has been very confusing and anxiety producing for a lot of people. So I just want to specifically say that what this means is if you have an annual review due during this time, your Medicaid coverage is currently being extended. That doesn't mean that the review won't occur. It's just that we're pushing it out until the public health emergency ends. Because our fear is we don't want to terminate people's coverage while there's a public health emergency going on. Therefore, we have chosen to keep people on Medicaid and not terminate them until the public health emergency ends. So we are not performing any reviews, but those reviews will begin after the emergency period is declared over. The public health emergency is not the same as the state of emergency. When the governor declares a state of emergency, that is about essential health employees and workers and things like that. We're talking about the public health emergency, which is determined by the federal administration and the state of Vermont itself. So you will know in advance when we begin those reviews, and you will know when and if you need to respond to anything from us through letters. If you expect to receive a letter and you don't receive one, please give us a call. Again, we are not ending Medicaid coverage during the emergency period unless the customer requests it. That's very important for people who are turning 65. They still need to contact Medicare and get Medicare coverage started, but their Medicaid for children and adults coverage is not necessarily going to terminate unless they request it. We are temporarily waiving Dr. Dinosaur premiums, beginning with the April bills for the premium due in May. These payments are suspended, which means that the premium is not due during this time. It also means it's not adding up, and you're not going to receive an invoice after the public health emergency with all the back premiums. But you are still liable for premiums once we start the premium process again. So you will need and expect to receive a letter from us letting us know that you will need to start paying that Dr. Dinosaur premium again. Okay, I got 3 minutes left. Long-term care. For long-term care, we're also accepting self-attestations for current income and resources for applicants for long-term care Medicaid eligibility determinations. And we're also suspending the transfer of asset rules. I'm pretty sure Betty's going to cover this more robustly for you, but this is my department's COVID-19 response. So I wanted to make you as aware of these as possible. All of this stuff you're seeing on the screen is posted to the DVA website, dvha.vermont.gov/COVID-19. And I also wanted to put you the email up to the DVA long-term care management team, also posted to our website, so I put it in here. If you have any questions, concerns, or if your provider has any questions and concerns, you should send that to the long-term care management team. Now, questions, I'm going to flash forward to my contact information. Check the chat for our 2 minutes.
Thank you, Victoria. We do have a couple of questions. One is, can a person use an ABLE account so they stay under that resource limit? This is when you were talking about the spend down.
What's an ABLE account?
It is the account that people can put money into and be able to save and not have it affect their benefits.
So that sounds a little more specific than I can probably answer, but if they give our customer service center a call, we can absolutely tell them that determination. It's important to know that the COLA review is coming up. That's the annual cost of living adjustment review. That begins in January for people who are under Green Mountain Care. So we will be taking a look at all of those accounts and limits and resources and sending out review notification letters during that time.
Why is there a 2-year wait for Medicare if a person is determined disabled, like a person who is diagnosed with a terminal illness and has 6 months to live?
That is a great question. One I unfortunately don't have the answer to because those are federal level rules. I'm an employee of the state of Vermont, so I know Vermont level rules. But I can tell you that during that 2-year waiting period, people are often eligible for Medicaid during that time because we can insure them under Medicaid for children and adults, which has a higher income limit and no resource test. So during that time, it's really important to contact us because we can absolutely see if you're eligible for any of the other programs through the Vermont Medicaid for Children and Adults program.
And if this looks like the last one, if the Medicaid review is pushed out and it is later determined that you weren't eligible during that time, then what happens? Might you?
That's a great question. Yeah, that's a great question. We're being very careful. The last thing we want is for you to go to the doctor and find out then that you're not covered, right? So before we start the review process, you will receive a letter from us letting us know that we are beginning the review process and when to expect it. Then you will get a letter from us when the review period starts. The review period is a month long and allows you to submit any documentation during that time that helps us make that renewal eligibility determination. If you are not determined eligible for Medicaid after that eligibility period and determination has been made, you will receive, let me back up. We consider that a qualifying life event, just like I was talking about earlier. So you will see us send you a letter letting us know that you are now in a special enrollment period and you can contact us and talk about your options with qualified health plans if you don't have other offers of affordable coverage. So for example, if you lost your job and applied for and became Medicaid eligible, so you got Medicaid coverage during this time, let's say you've been since hired and that employer has coverage that's offered to you, but you chose to reject it because you currently have Medicaid. When we send you a letter letting us know that we're renewing or reviewing your coverage and you respond back to us that now you're earning income, we will start a special enrollment period, but your employer will also start a special enrollment period. So whatever affordable coverage that is offered to you, a special enrollment period will allow you to enroll in that affordable coverage after that Medicaid termination is done.
Great, thank you. So as we wrap up, a quick note about some upcoming virtual events. We are hosting a series of parent focus groups to provide input into the Vermont Developmental Disabilities Council next 5-year state plan. There are several more workshops in our free online learning series. Details are on the homepage of our website, which is vermontfamilynetwork.org. You can also find information about upcoming events on our Facebook page and in our monthly e-newsletter. Thank you so much to Victoria for today's excellent workshop. You'll see the link to an evaluation in chat, and it will also pop up when we're done. Please take a few minutes to complete it so we can make improvements and fulfill our grant requirements. We want you to know that we are here to help. Please contact us by phone or email. You can also get connected by subscribing to our e-news, following us on Facebook, or if you are a parent or in the parenting role, joining our closed Facebook page, which is Vermont Families of Children with Special Healthcare Needs. Thank you again for joining us and have a great day.